Good morning, doctor. I've been feeling unwell lately and wanted to get checked out. Good morning! Of course, I'm here to help. Can you please tell me what symptoms you've been experiencing? Well, I've had a persistent headache, a sore throat, and I've been coughing a lot. I see. Thank you for sharing that. Have you also had a fever or difficulty breathing? No fever, but I have been feeling a bit short of breath, especially when I cough. All right, I understand. Let's start by checking your vital signs. I'll measure your temperature, pulse, and blood pressure.
The doctor proceeds to take the patient's vital signs.
Your temperature is normal. Now, I'd like to listen to your lungs. Please take a deep breath for me.
The doctor uses a stethoscope to listen to the patient's lungs.
I hear some crackling sounds in your lungs, which may indicate an infection. We'll need to run some tests to confirm. I'd also like to take a throat swab to check for any throat infection. Okay, that sounds good. What kind of tests will you be running? We'll start with a chest X-ray to get a better look at your lungs. Depending on the results, we may also perform a blood test to check for any signs of infection. The throat swab will help us identify the cause of your sore throat. I understand. Do you think it could be COVID-19? It's a possibility, but we can't say for sure until we get the test results. In the meantime, it's important to take precautions, such as wearing a mask and maintaining good hand hygiene. I'll definitely do that. What can I do to feel better in the meantime? I recommend getting plenty of rest, drinking fluids, and taking over-the-counter pain relievers for your headache and sore throat. If you have any trouble breathing or your symptoms worsen, please don't hesitate to come back or seek immediate medical attention. Thank you, doctor. I appreciate your help and guidance. You're welcome. We'll get to the bottom of this and ensure you receive the appropriate treatment. If you have any questions or concerns, feel free to ask anytime.
After X-ray and blood testing.
How long will it take to get the test results? Typically, we can get the chest X-ray results within a few hours, but the blood test and throat swab may take a bit longer, usually a day or two. We'll inform you as soon as we have the results. All right, I'll patiently wait for the results then. In the meantime, make sure to isolate yourself at home to avoid potentially spreading any infection to others. I'll do that. Should I inform my workplace about my situation? Yes, it's a good idea to let your workplace know that you're not feeling well and that you're undergoing testing. They may have specific policies in place. Okay, I'll contact them today. What about my family at home? It's advisable to inform your family members so they can also take precautions. Try to maintain some distance within your home, wear a mask, and practice good hand hygiene. Understood, doctor. I'll talk to my family about it. Great. If you have any household members with underlying health conditions, they should be extra cautious. I'll make sure to inform them as well. Is there any specific diet I should follow? A balanced diet with plenty of fruits and vegetables can help support your immune system. Avoid any foods that irritate your throat, like spicy or acidic items. Thank you for the advice. I'll stick to that. You're welcome. If you have any questions while waiting for the results, or if your condition changes, don't hesitate to call the clinic. I will definitely keep that in mind. Thanks again, doctor.